PET CT scans and the potential for misleading activity. So, hi there. My name is Dr. Walter Lemo. I'm a naturopathic physician with a practice solely focused in cancer care for over 20 years. I remember in the beginning of my career when PET CT scans were not available, but we were really lucky to collaborate with a brilliant medical oncologist who saw the potential value of these PET CT scans where they weren't even available in British Columbia, and they would be referring people out of province, out of country, because in his wise experience, really saw, hey, there's definitely room for this new promising type of technology to better help assess patients' responses to treatment and etc. So, anyways, this message was prompted by talking to a couple of my patients, where they were completed, both had lymphomas, one non-Hodgkin's and one Hodgkin's, and PET CT scans were being done to assess how things were responding to treatment, one post-treatment, one in the beginning phases. And so the thing to bring up about PET CT scans is that the common tracer that is commonly used these days, that's more popular, is glucose or radioactive sugar. There are other ones for other kinds of cancers, but this is, I would say, the more popular one. And as we know, when there's like activity and metabolic activity in cancer areas, the tracer can suck into those cancerous sites. But the thing, though, that people don't really understand is that they're not always indicative of active metabolic cancer. So think of cancer, for example, as the wound that doesn't heal. So it's like this inflammatory environment. So I remember once, I was looking at a patient's report I had a consultation with, and I noticed that the PET CT scan was showing a lot of activity in the tooth. And it was like it had some really decent, it's called SUV activity. And I said, hey, by the way, do you have any issues with your teeth? And she was like, yeah, I got this really bad tooth that I've just kind of been neglecting. And so I said, do you want some advice? I go, the PET CT scan is actually picking up that really bad infection in your tooth. And that's what I mean. It's like the PET CT can pick up like infectious processes, and it can't differentiate if it's cancer or not, necessarily. There's like when say sometimes a tumor mass is killed, there's this inflammatory thing that happens too, because like, where do those cancer cells go? Where do those tumors go? They got to go somewhere. The body and the immune system is dealing with it. There's inflammatory processes that are occurring. So if you did a PET CT scan, it could show activity, and then you're scratching your head, is that cancer? It's not. And sometimes I've seen that this metabolic activity, even though there's no like true active cancer, but there's some background inflammation or something going on, could last 3 months. I've even seen it last 6 months. I've even seen patients where say they have there's two patients that come to mind with who had advanced colorectal cancers, and they were going to get a surgery done for the lungs, and they do a PET scan, and the bowels are all lit up. And so then everyone, like all the surgeons, backed off. No, no, this is advanced. It's not localized to the lung anymore. And I was like, this doesn't make sense. And those who probably have more experience in being around PET CT scans, like myself, we were like, hold on a sec. And then sure enough, they do a repeat PET CT scan in 3 or 4 months, and everything is fine in the bowels. It was just some kind of weird thing that occurred in the bowels. It got really metabolically active for some reason, and then it just went away. So this is the kind of the one thing about PET CT scans that you always got to keep in mind. They're amazing on one side, and look and assessing activity. So say if someone's like doing treatment and you're seeing like less metabolic uptake, which is a good thing. When people do them, it's like, we didn't find any active cancer everywhere else. It's maybe more localized to this one area and nowhere else, which is another great thing. Or there's no evidence of disease, another great thing. But also keep in mind that PET CTs looks at metabolic activity, but it doesn't have to be always directly cancer related. So, as I said, it could be inflammatory related, it could be post treatment inflammation related. and it could be something other weird thing related. And that's what you always have to keep in mind when you're looking at PET CT scans.